one. I'm going to hit record here. But I'm going to try and pound through a whole lot of issues. I know in a number of these threads, it seemed like there was a lot of interest in different ways of being able to practice, as well as kind of for both direct, I'm a psychiatrist, but more of direct primary care for how to do like subscription-based out-of-network private practices, as well as just some things like with telemedicine and ways of how can we bring this all together. I say myself, I've been out in the space now about 2.5 years here in Wisconsin, left the University of Wisconsin, where I'd been working as private practice and as faculty for a number of years doing outpatient practice and pushed and pulled in different ways. And I worked with a lot of Epic employees, and it was also a bit of a niche, but more of ADHD in adults, which I know is the weird stepchild of our field, but that's what I had been in. And I saw so many different ways that we could work with their patients, and quite frankly for me, ways to quit wasting their time of having them commute in on their one day off, not one day off, their one day in Madison per week and whatnot. And I did a lot with policy with AMA and APA, so I knew what was possible from a policy side, and then also just from like a tech side of advising a lot of the health tech startups there and being involved. Just myself as a guy that is always kind of looking for different ways to do things and keeping up on different bits of software. But I'm just going to show you guys a little bit of how this works, some different bits of software, see if some of the workflows might be able to help in what you're doing. And then at the end, we'll open it all for questions. And if you like it, there's a chat button at the bottom of the screen. Feel free to write anything in there, and then we'll be able to get to those kind of at the end. And I'm just going to have people on mute right now just so that it goes forward. But what I'm going to do is, first and foremost, if you guys are on Zoom right now, you clicked a link, hopefully you got in, not too difficult. This is what I find for patients. I apologize, I should have turned off the chime when people come, but I'm just going to walk you through. One of the reasons I use the software is, one is I'm just able to do one static link that I can put in all my email communications, my text message communications for patients, so that they can find a link, click it from their phone, from their computer, and get on. And then the other things I like on here is the ability to easily screen share. For me, with patients, I don't know if you guys, I share my screen all the time, and I'm drawing all the time. I keep a ream of paper. And one of the things I like on here, and I'd always been an Apple guy, but I just went for something that was cheaper when I was getting into the business when I started up. And I was excited by Windows Ink, just because on here with Zoom, I'm able to do complete whiteboarding. And with this stylus that we have, it's quite a bit easier for the things that I'm drawing. So I find with patients, I open it up, they're on their phone or whatever, we're able to draw through things. I do a lot of talking about doses and, I guess, neural pathway with patients as they go through. So I need to be able to replicate what I do in person. So this is just one of the things I want to be able to show. It's easy for what we can do on here. You can also easily share our screens. And this is how I'll walk you through a lot of what's going on. But I find with a lot of telemedicine companies, American Well, Teladoc, a lot of them, they don't allow screen share or do anything with it. And for me, if it's just me seeing and talking to a patient, that's only a fraction of what we do as providers. And I practice in those, but I feel like I'm practicing with a hand tied behind my back. So as far as I'm concerned, if you don't have whiteboarding, you don't have screen sharing, to me, it's half-assed software. We can't keep up with something such as Zoom. So that's the reason that I use this platform. I know to get the business associate agreement signed for HIPAA compliance, it's definitely more expensive. I find this is where I do some other outside consulting. So I get my own Zoom link and things through them. You have to buy them in bulk. But that's what we're on right now. You're using Zoom. Hopefully you got in all right. But in the end, like this is the practice that I came and built. I know ADHD, especially in adults, is an area with much kind of stigma within our own profession. The reason I wanted to get into this is actually wanted to bring more thorough evaluations and closer kind of management and fine tuning of medications, as well as getting to a lot of other non-medications. But the way that I always wanted this to start up is, starting with, I'll just walk through here. And this was all just done in Wix. I'm by no means not a programmer. I am very fiscally conservative. So when I did this in my mid-30s crisis, I'll call it, when I was just bored at work, not able to change or to do anything new, I wagered like, okay, maybe in my mid-30s crisis, I'll buy a cheap used motorcycle for 10 grand. I don't know where that idea came from. I thought, okay, maybe that's my next thing I should do. But then it turned out, I can do startup in 6 months operating costs for that. I could probably do it even cheaper now, because it's amazing that things in healthcare don't necessarily have to be expensive. And if you guys want anything about startup for the legal, the accounting, the like places to have offices and whatnot, happy to talk about as well. But for me, I model a lot of this off of direct primary care models that are coming out, where it's completely outside of insurance, monthly subscription model. The thing that I've always appreciated in healthcare, and I want to put my money where my mouth was transparency and consistency, meaning that it doesn't matter who you are, you know exactly what it's the same cost for everybody. You don't feel like you're getting ripped off by not having a special deal, and completely transparent pricing. I hate things. I don't care if it's software. If I have to contact or do a demo to get a price, I feel like I'm going to get ripped off because I'm not doing bargain shopping. I realize I don't trust things that don't have dollar signs anymore. I don't care if that's with insurance or whatnot. So when I came out, and I had these priced differently, these were numbers that I completely pulled out of different areas. But the reason I wanted to do the ongoing, well, one is I wanted to do a much more thorough diagnosis, full 2 hours, be able to bring out different rating scale, tracking type things I'll show you, but also bring in more computerized testing and for neuropsych evaluations, but be able to get people in faster to do it. And then for the ongoing treatment, the reason I wanted to do the monthly subscription is I realized when I was at UW, so much of what you do, especially with ADHD, you can't really do refills on medications. So people either had to come in for an appointment, or they'd have to leave work to come in just to pick up a piece of paper prescriptions, because we didn't have electronic prescribing, despite a lot of banging on the door for it. And I realized so much what I was doing was just managing people's MyChart messages. And people wanted the MyChart message or phone call. And the end of my day was always MyChart. I had more MyChart messages and phone calls to return than I had patients over the day. And obviously patients wanted to do that. It's easier, it's more convenient. They didn't have copays. And then I had to manage a lot of patients just over that when I was forced to go into the inpatient unit to cover 50% for 3 months, as all of us as faculty did, because they can never staff the inpatient unit. And I realized I am forced to manage a lot of people over this way. And I found, I can actually do pretty well, because I couldn't get them in for appointments. I was booked out at generally 3 months. At that point, it was 6 months. So I learned I had to manage a lot of people that way, and I could do a lot. I could manage a lot of things with medications, respond to what people needed. And I realized in a way that's kind of the way that our system is going, where people are going to want that convenience. Obviously, if there's something we have to do in person, we have to do it. But otherwise, there's a lot that we could do remotely. So I just wanted to make it so that I'm being, in a way, fully compensated for all that. So I just want to think of unlimited. I equate it kind of like a Netflix subscription, especially in the beginning. I want people to binge on me. You're going to binge a lot more on a Netflix series than you ever will on like a $1.99 per episode on iTunes. And that's the whole, I don't want people having to think about it. If they have a question, if they have a concern, I don't want to say, oh, you have to come see me, and then not have a reason why, but only because I'm going to get paid or be able to bill for it. I just want them to be able to use me as they are, but we obviously have minimums for how often they have to be seen. So that's where this came. I just wanted to have simple, transparent pricing, and then be able to actually reach out and get a lot of other discounts and benefits for patients. The thing I didn't realize is if you just reach out to companies, and basically if you're a physician and you say, hey, I want to refer patients and get discounts for them. I don't have any financial ties with these, but it's amazing how much you can get just with a code or something if you just ask for it. I haven't been able to utilize a lot, but it is amazing just what you're able to find for them wanting to get people in their doors, especially with newer companies. But in the end, the thing that I also wanted, because I realized myself, I don't care if it's a haircut. If I have to pick up the phone and call and go back and forth on timing, I'm probably not going to do it. I think I'm definitely on the older side of the millennial thing, but I don't know you guys, I hate the phone. So I just wanted, and really wanted to set it up. And quite frankly, this can all be done through the health record system. And I'll show you guys that. The workflow of it doesn't allow two-way Google sync, and I'll tell you why I like that. But I just wanted people to be able to see what was available, be able to click and see exactly when I'm available, click the time, put in their information, have it scheduled, get reminders, and have links to be able to add it to their calendar and get everything in place. I use Snap appointments. It was one of the cheapest ones to sign a BAA for HIPAA compliance, where it's like $30 a month. It does. Why don't you use it through my? They actually have a very robust here. I'll show you. Just go here. I actually had a buddy, so I helped set him up. He just wanted to do something very similar. So I gave him a template to my website, and he didn't change much. This is what it looks like through the EHR. So using Charm, he's able to set it very similarly, and it works very well. And then it's all in. Well, there's not many slots there, but it's click in. Yeah, there we go. So you see the time, and you can do it. But it doesn't do a two-way Google sync. And I know that sounds so petty when I say that out loud, but what that means is I set my schedule in my practice or on Snap appointments, let's just say 8 to 5 days a week. But then what it does is with the two-way Google sync, because I don't care, it can put patients into my schedule. That's one thing, so I can see them. But the biggest concern is I want my personal calendar to block me out online. So I only have to manage my personal calendar, and it'll automatically block me for anything else that's on here. I don't use assistants. I don't have staff. Maybe I'll pay someone to answer the phone just for the people that call me, like finding my number somewhere and haven't been to the website. But otherwise, I don't need anyone for staffing. People can reschedule through the email. I don't care about no-shows or cancellations because people have unlimited appointments. So I'm not trying to track them down or worry about that because technically they've paid for unlimited, and I'm not going to, if I miss it, I just take the time. But this has changed how I go through everything. And I don't care if it's even business meetings. Like I put a link to this exact page right here. And I recommend if you guys have anything like this, put it in your signature of your email. I just put this business meetings. So if people are actually going back and forth, when can we meet? When can we do this? I just say, just go to my website or click the link in my signature, do business meetings, and just find a time with me. And then it's in my calendar. They get a Zoom link. We can meet online. We can meet in person. We can do it by phone. But that's changed back without having to go back and forth in email so many times. So that's where I am from a scheduling perspective. When it comes to the health record system, what I wanted was something that had a robust patient portal, because so much of what we do is going to be through the portal. And then also I just wanted tons of customization. I probably demoed, probably 40 different EHRs. And one, I'm cheap, and two, I'm a bit of a control freak. I played with a lot, so I always recommend create it on your own and create it to see what it's like from the patient side, to see if even everything they say actually works. I kept wanting to like Practice Fusion, but none of the stuff they claimed actually worked on the patient portal side of it. But from the patient perspective, they basically, when they're working with me, they either schedule through here or they log in up here to go to the portal. I'm just going to get into a dummy account here, and everything I'm going to show, actually, I'm going to get into it in one trick so you can sign into stuff without signing out is use incognito browser in Chrome, and then you can log in without messing up what you're already logged into. And everything I show you guys, these are going to be dummy patients. So basically, I just wanted a robust patient portal. This is the patient's view. So if they did it all through Charm, which eventually I want to, they can schedule right through here or on the website. All their appointments pop up. They can fill in all their questionnaires, so these get sent to them right when they start. That also has a place so they can actually sign all of their consents electronically, have that all stored in one place in their chart, as well as you can create all of your new patient forms. So even when they do this, they actually fill in all their own demographics, which automatically feeds into my chart. So I'm not filling it all in. And then I'm able to, just like you make a SurveyMonkey type of survey, you're able to build the type of questions that you want freehand or whatnot. So the time I see the patient, I have majority of my history done, and I'm able to then, I do dual screen. And if anybody hasn't learned this, at least on a PC, is the Windows key and left or right arrow keys will allow you to bring up side-by-side screens, which is an incredible way to make things easier. And I drag and drop to do it. But that's how I generally start with patients, so that they can fill all this stuff in before I even see them. And then once they're in there, if they need a super bill, it's 2 clicks. After they have a visit, it'll pop up in this billing section. You can interface with lab results. I can fax things over and send them. In here, it's going to cost more. If you have a bigger practice, you can interface with labs. It's someone has to pay for that interface. So the labs generally want a larger contract. I'm just a small little guy. If people have prescriptions, if you do it through the platform, they can just request refills right in here. I'll show you what it looks like on my side. So you get that refill request, and I just respond to it when I get it. With their documents, everything I have. So if I'm uploading them a letter for their work or accommodations, or their like computerized kind of testing that they do in place, so they have all the records, it'll all pop up in here for them. They also, if you want to share, like when I send them with lab orders, they can take the order, they can print it, they can take it to their PCP, they can take it wherever they want, and it'll all be there in one place for them. As well as if my patients go anywhere, if they transfer back to their primary care, they move across the country, in one click, I download all of their encounters as a PDF and I upload it here, and then they're able to go with their records wherever they want. They can download it, they can email it. It gets around release of information because it's the patient's data, and if they're choosing where it goes, it makes it a lot easier for me. I can also fax it directly to places if I want, but it's actually easier for me just to share it with the patient. And I like to say, here's your evaluation, here's your testing, all wrapped up in a pretty package, no matter where you go. It's you paid for it, it's your data. And then also what I like is at the bottom of the, let me see, at the end of my note, the last few bits of my notes, this is all taken out of my template, but things such any of the vitals, aspects of diet, lifestyle, and then everything that's in my instructions section. This is all just from my note. I'm not making this separately, but it'll all automatically post here. So patients have all of their instructions after every visit that'll pop up there. So I just like this as a huge menu of options, and then I'll obviously update it as we hone in on different type of things. But I like that it's all there for the patient. And if I share any of my documents on medications, on mindfulness, on whatever, they'll all pop up and be attached there, and then also be there in the document section so that they'll always find them in their kind of repository. Let's see. So this is what I wanted from I just wanted an easy patient-facing side so that they do this. Let me see. And then it's going to switch here back to my view. Let's go to the practice portal. And in here, this is what Charm looks like. This is my side of it. I'm just going to go into that the other side of that same patient. I think, who is it? Joe Smith. Yeah. Now what I liked here was the customization of how I can edit every aspect of just about everything. If I want to see like the full kind of timeline from when this patient, this is a little bit different, but generally all of the encounters, all of the messages, everything they've filled out. If I want to find anything, it's all there in the timeline. If I want to see all the documents or import anything for them and share it with them. If I want to add new medications or send different medications. Although this is if you use this platform for e-prescribing. They didn't have electronic prescribing for controlled substances when I started with them 2.5 years ago. So I've been using Doctor First. Now they do have EPCS, but I could get into all the specifics, but their workflow is not well implemented. So I still use this as a separate window. Doctor First, I've enjoyed because I can simply reorder. I don't have anything in here. This is just me as a dummy patient, but click a button to reorder. With EPCS, you need to have 2-hit authentication. So either you have a unique number generator little device on your keychain or on your phone, or I found the one benefit of an Apple Watch is actually being able to just bring up the number right from my wrist while I'm filling in prescriptions. So I have a bit of a workflow where I'll get a message from a patient, say Joe Smith message, hey, due for my refill. I open a tab, I go in here, I look up Joe Smith, I see when it was, I go to the next tab, which is I'm sure all of you have your different prescription drug monitoring databases. I have to look them up in here, and then if it looks okay, I come back here, I'll reorder it, I'll date it for the appropriate time, and then I go back and say, message back, hey, in there, all good, see you next week. Check vitals at check blood pressure and heart rate at the pharmacy when you fill it, is how I'm generally doing it. I'm monitoring this most of the day, but I feel like as I'm doing that, I don't feel like it's just added stuff for my day. Like that's technically this is my patient. This is a person that has reached out, on the website, found me randomly, probably by Google, saw something that they needed. They signed up. We met in person. We have an ongoing relationship, and able to be there for them. And it's all part of their fee. And I realized just how different it is when you can say this patient wanted to work with me and this is somebody I want to work with, as opposed to where I was before, which is this person is seeing me because insurance put them in my schedule. And I didn't realize the amount of pride, like when I'm responding to things, like I'm happy to go on here and actually like respond back to messages, or even when I'm like doing prior authorizations or doing some other work for their accommodations or something like that. It is amazing how much happier I am doing it, knowing that, hey, this is part of, in a way, what our relationship is, what my role in this is, feeling very compensated for it. And like, this is my person. And I'm going to advocate and fight like hell for them. And I didn't realize just how different that was before. It was just like, it was extra burden on top of your already busy day. That was something I wasn't prepared for. I hadn't really thought about. But yeah, it's made me appreciate it. So my general routine is kind of in the morning, I'll wake up, make coffee. I set my own hours for when I want to be available. And then I'll respond to messages, do refills, get back to what's going on. Even when I travel, like I could have someone cover for me to go through and do this. But at the same time, even when like while I was abroad with telemedicine rules, as long as the patients are in places I'm licensed, I can see from anywhere. So with the use of a VPN, I just use one called Nord, so I could actually e-prescribe. Don't travel out of the country and try and e-prescribe, because you won't be able to unless you have a VPN. But I was able to sit out in Paris. Girlfriend would sleep in. I'd get up. I'd go out to the patio overlooking the Eiffel Tower. I'd sit down, have a cup of coffee, respond to messages, do that for about 20, 30 minutes each morning. Day's done, day's wide open, and many happy patients and everything that they need kind of where it should be. It's most of the things you can do through messaging, and I'll just see them online when we get back. Or if I needed to, I could have done appointments, technically over video, as long as they were in a state that I was licensed. I'm just trying to think of other things in here. What I like the reason I went with Charm was a lot of customization in the robust patient portal, and the fact that things just kind of work. The areas I wasn't using it and still don't use it for electronic prescribing, I just find it to be cumbersome on here, although I really, really want to. And if anybody is going to do this, I'd recommend just use one platform and keep it in there. Their scheduling works very well, minus the lack of two-way Google sync. I'm just very stuck in my ways right now. But if you can do everything in there, including like faxes that come in, so if that's the one thing that I pay for with it right now, is for a fax number that will come directly into so fax, I don't have any for this patient, but if anything comes in there, it'll come right to me from the pharmacy. I can fax right back to them. I can fax anything just by drag and dropping it onto here and sending it right out. So I certainly don't use any fax machine. My entire equipment is this little laptop I'm sitting on right now that I can take anywhere, do things from anywhere. And if I combine that with a PDF signer, I use one called PDF Filler. And I'll show you guys a link to a full just bunch of resources I had done for Wisconsin Psychiatric Association meeting last year. So it'll show a lot of the websites of the things I'm talking about. But that was the one thing that I liked. So that's, I think, $20 a month. But otherwise for this platform, what I liked about it is it's free for 50 encounters a month. So I was able to completely get in here, build a practice, try it for myself, try on all sides, no questions asked, and I had to put a credit card down, or maybe, did I? I don't know if I did, but they signed their, easy to sign BA for HIPAA compliance. They maintain all of that. And then if you do more than 50 encounters a month, and that doesn't, like messages aren't encounters, but only signed notes. If you go more than 50, then all of your encounters are going to become 50 cents per encounter. So what I like there is trying to, my initial goal was 100 total patients, period. And then it went up. Now my stretch goal is kind of 200. Just, I'm not afraid to talk numbers here. That's where, like, even if max and I saw every one of those patients once a month, which I don't, that would be a max of $100 a month for everything. So you know what it's like, and it can build with you. As opposed to like starting very small and paying full out for all your software, even though you're taking you months and months to build patients. So that was one thing I liked. And something you can do, they also have their own billing things within it. So if you do insurance, they have a whole platform of insurance billing stuff that I can't tell you much about, way over my head. But they also line with a credit card merchant servicing account called Bluefin. Personally, I think it's crap, and I hate that they won't give you transparency in terms of what their charges are. They'll say they're cheaper, but when I actually look at it, they'll give everybody different numbers, and I just don't trust things that do that. And they have terrible analytics and ways of getting to their platforms to see it. So I used to use it, and it does recurring billing, so I could just capture their card, I could swipe it, or I could enter it. Very easy, store it, tie it to everything. It worked very well. And I would still use it because it's all in there. I could swipe the key reader or enter it. I can store it. I can add the type of recurring. It works very well. But what I found, what I liked, is when people schedule with me for their initial appointment, they pay for this one right up front. So they put in credit card information. They have unlimited follow-ups. So they don't have to pay for the other ones. But as soon as they create an account, what I found, Snap, this is confusing, creates an account with Stripe. Stripe is what, like Uber and Instacart and all of that works, and they have much better analytics. And this is where I can see all my patients. I ask them, if they want to enroll in the membership, I add a monthly subscription for them. You can see numbers. The danger of too much analytics is you start comparing yourself month to month and how you're comparing. And you can see how it goes. You see how many payments, how many new customers. And if you look at it over time, the thing that I found here is you're able to follow. So this is, I don't know, September. I started using it maybe in May. But what's unique is, and I'm probably showing you is way too much information, but the thing I found is following like a nice linear growth curve. I'm a guy that just wants to change. So I want to innovate and I want to change things too fast. And this actually helped me like get outside my own head and say, Jake, if it's building, don't monkey with it. Let it do its course and then change if you start hitting a lull or if you start dipping. So that was actually very helpful in here from the Stripe side, and I don't want to let it go. And it's easy. I can refund payments easily. So if there's anything going on, it's odd being like in control of it. If I mess something up, I'm going to go there and I'll refund. Oh, hey, I credited back $25 or $50 for that. And I feel like preemptively, like one, that's the way I want to practice. It's the way I want to do customer service, to acknowledge that, oh, hey, I missed that, or I didn't get that thing in the way that it should have, or I was late or whatever. And being able to preemptively get something back to them with simply a click of a button to refund $25 or something has been very helpful. And if any of you are doing more of it, this is a member, monthly member rate, whatever, but where you can actually see and track your analytics to see how those numbers are going has been very helpful. And it definitely does not work as well with Bluefin. But that's one of the reasons why I still use it, because it's immediately tied with Snap. But from a payment standpoint, I've found it helpful. My biggest problem is when people's cards either have insufficient funds or they expire, is they get reminders, but having to reach out to people to update their cards is my biggest issue right now. Trying to show. Other things that work with, and this is something I built back in residency and still haven't found anything quite the way I like it, is I make these, so I do it, everybody, I just use open license ones, PHQ-9, G87, ASRS, make an individual file for each person. This is just in Google Drive. This is Drive for Business, which is tied to my domain with Wix. So I think it's like $5 a month, but you sign the BA for HIPAA compliance. Make this, I send them this link in their welcome email so that everyone has their own unique link. They fill these out, or if they forget to, I have synced links. So this gets synced into an iPad folder that I bring up from shared Google Chrome links on my iPad in session. I hand it to them, they fill it out, and then it'll automatically pop up. It'll time date stamp it, it'll create a new row. So in this case, the first time seeing this guy, I'm seeing exactly how things were scored. I'm trying to compare like, are depression and anxiety causing the ADHD symptoms? I correlate it to what their regimen is at the time. I can scroll over and see all the individual scores. So it's always it's always hypothesis testing. Which one is causing which? Or are they comorbid and we want to treat them separately? But then being able to actually track your outcome over time. So this is a kind of a boring case here, but of able to actually see where things were diagnostically and then track it over time to make sure that your hypothesis is right and you're actually treating them to remission. And if you want, I don't know, you can make it prettier by graphing it out. You can click on a point and correlate it to what was their med regimen at that time. Should highlight the other side. Google broke this a while ago, but basically I just use it in here. But all I do is just give them that link and I have people fill it out. Or if we're doing Zoom, I'll shoot them the link and they can do it while we're together in session like this. And then it automatically pops up in here. We do a screen share and we look at the results together. That's if anyone wants to do more with the rating scales, patients love their own data. It's not just a macro level admin type of thing for looking at it, but I find it so helpful to be able to actually, I always tell people, this is what keeps me honest. I don't control this. This is if I see we all see people through rose-colored glasses, and if I keep trying, now I look for ADHD. Now I'm very, I guess, probably biased towards that, but I know that's what I'm looking for. So I want to make sure that I'm not missing other things, and that I'm not trying to pigeonhole or put kind of a square peg in a round hole with that. And I want to make sure that, hey, are the treatments working? So that's a little tirade there, but I can show people if you want to set these up. I've tried to build a number of these out. Everybody has ideas for how and when to do it. I'm still using this old one that I've been using in residency. I use it on a daily basis. And then let me think of other aspects to show. I don't know if anyone's interested in ADHD kind of testing kind of things. I use something called a TAMO through Pearson, although it's going to be discontinued in June, so I'm off to the races to find other things. That actually looks at motion and attention, wearing a headband that tracks motion, actually compares how you're moving to age-matched controls and what percentiles you fall into. Same type of thing for how you're taking the test, what types of errors. I always think that age-matched control, what percentiles, what's so helpful to see if it's significant. And people love the graphics of showing kind of like what state are you in. These are 30-second blocks going across. They show kind of how attention might be moving. Once again, how this is going away, so I can't recommend it right now. But if anyone's interested in this space, happy to bring you to. There's a number of us trying to pick, okay, where do we go next? But I have that. It's really interesting if you can do it again with people. They actually track progress. You put them on a med, and it's amazing how you'll see all of these numbers change. That's neither here nor there. I'm just trying to think. Obviously, I have a lot in my head. These are, as I do a lot, anything with this that I use. So as you can see, I use a lot of software. I use Zoom. I use Snap Appointments. This is Charm EHR. I use Stripe for the payments, Dr. First for e-prescribing, the PDMP, TAMO testing. But as far as I'm concerned, if you're not okay with tabs, this is a difficult place to be. But with all of that said, I'm going to pop this open, and let me try and get back here to if I can move all of this to this. Well, I don't see anything in the chat. But actually, if you'd like to take yourself off of mute, I'm more than happy to take any questions and fill in any of the blanks that I'm sure I kind of rushed through if people are interested. Or if you'd even like to type in that chat box. Yeah, I think you have to click unmute, which I believe is in the bottom left.
Hi, this is Josette. Can you hear me?
Yes.
Okay, great. I have actually several questions, so just let me know if somebody else has questions. I don't want to hog the time here. So Zoom is HIPAA confidential or HIPAA secure, or
you have different versions. You'll have to sign. They're really kind of annoying to work with. I think it's set up as you have to buy, 10 licenses at $20 per user per month. So you have to have kind of an enterprise with it. This is one of the things where I do a lot of outside consulting or outside work. So one of the other companies I work with is where I get my HIPAA compliant version of it. And that's something I didn't mention. Okay. Is one of the things that if you do a lot of other like telemedicine or other things on the side, what I find is so helpful is I work with numerous telemedicine places, and instead of me giving them time and blocking out my calendar, I have them schedule into my calendar just as if they're another patient. So that actually makes it so here's my free time in my calendar that's automatically blocked out from my personal calendar. And that way my patients American Well patients, T psychiatry patients, people are all kind of going for those same spots of me, and I just go between different windows on Zoom. And
okay. And how much do the 10 licenses cost, you know?
Well, they're $20 per license, so it'd be $200 if you need them all. But that's where I think actually people bonding together, and it's something where I think would be really helpful as multiple practitioners. If we wanted to do kind of like group purchasing of things, that would actually allow us, because I think the $20 a month is a very reasonable fee for it. It's just you don't want to, as a solo person, you don't want to go there and have to pay 10 times the cost.
Right. Okay. So I guess my next question is the Charm PMR. Is there a cost to that? Your EMR?
How much does it cost?
Yeah.
It's it's free for 50 encounters a month. Anything above that is 50 cents per encounter. So that's a signed note.
Yeah, you already said that. I'm sorry. You already said that. I got that down.
You have other add-ins. Even if you wanted, they have Zoom that you can actually build a Zoom link into that. I'm glad that they use that as their partner. So it actually goes right into their calendar invite. That's $20 a month. So if you want to just do it through Charm and not worry about group licenses, you can. What I didn't like about it is I couldn't use it as standalone Zoom, like my own thing where I start a meeting and I set it up. I can only use it for things scheduled through Charm was the reason I don't do that. But they actually have it built in now for $20 a month, and you don't have to worry about it. That is the HIPAA compliant version.
Got it. And then the Doc First electronic prescribing, is there a cost for that?
That is, if you do it with the web-based side of it, it's like $650 a year. If you do just their handheld version on here, I think I want to say it's $350. If you want to do e-prescribing controlled substances through Charm, I think it's $250 a year and then like $10 a month maybe. So it's cheaper through Charm, but they didn't have it when I first started. And now that I'm used to Dr. First, like if you're not used to it, just go with Charm and be happy and don't look at anything else because it's all built in. But from how you search for a pharmacy to how you can't change a dose on a prescription, believe me, I give a lot of very minute feedback, and I'm waiting for them to get to a lot of it.
Okay, so I'm assuming that most of your appointments are home-based. They're not going to a clinic to get to you then.
Yeah.
Right?
Yeah, I've had things,
okay.
The majority of people are either at home or at their work, so they don't have to leave. And I've had a lot of people just in their cars in between, like when they stop. And I've had one person, she, instead of driving to clinic, she took a friend from work. They went and got Starbucks. They went to the mall and got pedicures, and she's talking to me while she's getting a pedicure in the middle of a mall. But she was happy as can be. She brought her friend over. I got great collateral, and it was something I do.
And what do you do in case of crises and emergencies where, like, you know, like somebody needs to be called because somebody's refusing to go to the emergency room or something?
Yeah, and in those, obviously, I'd be able to send people to emergencies. To emergency rooms. Obviously, you know, I have been available and I have taken some later night calls. That's rare in here. I do, like, this is just one part of the way that I practice. I actually work with community support programs, rural geriatric intensive outpatient programs, some inner city clinics with more of a collaborative care model, as well as even like methadone and substance use clinics. And it's not that I would take this model and take it to those other places. But what I found is the tools that I've built here, if I'm able to relay this and work this way as we are now with a team, as opposed to directly with the patient, it's worked very well. And I think it'd be monumental, especially in ACT teams and community support programs. But fortunately right now, Medicaid has all these staunch rules where they say that care only happens in qualified locations and not with qualified individuals. So Medicaid's not going to pay for doing it on site with people, which is too bad. But yeah,
okay.
this is my entire, I didn't make that known. This is basically, this clinic has been built in my free time. Now it's trouble saying no to all these part-time gigs.
All right. And then how do you make your forms for Google or HIPAA compliance or something to that effect? How do you do that?
Yep. One is I don't put PHI into it. I never had before, and I just use my same moniker from before that. But if you have the Google Drive for Business, you can sign their business associate agreement for HIPAA compliance. So you have to have the Drive for Business. The easiest way I found to get all this is when I made my website, I used Wix. I was able to, for like $5 a month, add my email domain. So I had envisionadhd.com, and I was able to add jake@envisionadhd.com, and that was through Google, and it came with a linked Google account, and that's what I use.
Great. Okay. And in how many states are you licensed, or do you?
I'm licensed in a bunch. I'm with American Well, and they got me licensed through all the states in the Interstate Medical License Compact. And honestly, it's kind of a pain in the ass, with the exception of like Minnesota and Illinois. I'm in Wisconsin, so people can drive up to those places, or if they drive back there, I can still see them. But I am licensed in many states, and that's one of the reasons I keep working with American Well, because they maintain it. And let me tell you, it's a pain in the ass to maintain.
Okay. Yeah, I don't know if I have any other questions. I'm sure other people do.
Yeah, I'm getting this
question,
website. Please go ahead. Actually, I'm just going to go over this.
My question is about the when you were talking about sharing the screen. And thank you so much, Jacob, for this presentation.
Oh yeah, I see that question.
So just when you were talking about sharing the screen, something about Windows.
Yep, is on Windows. You have that Windows key. You have the hit the Windows key, and then the left and right keys. Windows key plus left or right arrow. Let me put that in there. So I'm just going there.
Okay, thank you. Yeah.
And then I think someone was asking about kind of abuse by patients with this model. As I say, this model, you want to do it with the right patient population. There's no question. Knock on wood, I've had some I don't work with kids, but I've still had calls from parents, of adult kids kind of at night that they just want to talk through something or give me a heads up for something. I've had some people where they schedule with me more often while they're going through transitions. I think the most I've had is a person schedule once a week while they're doing some intense. I think they were studying for an for their not board exam, for their bar exam. I couldn't come up with that. And they were seeing me about once a week just to kind of check in on things. But that was the most that I've done. So in the end, I want to work with high functioning people where their time is just as valuable. So that obviously, they want to make this as convenient as possible. And a lot of the times in here, my thing is making sure that they're actually scheduling those follow-ups to come in and not just messaging for a refill.
This is Joe's head again, so I have another question. So I have an office manager right now, and she screens for substance abuse because I feel like that's a very specific training, and that can interfere with our diagnoses, obviously. But you don't have anybody doing that for you. So do you use any kind of screening when you have the patient initially fill things out, or?
Yeah, in there, when they fill out the, I'm trying to think where I can find it on the portal here. You can make this as comprehensive as you want. So as soon as they schedule, they get all of this and they have to fill it all out. So you can make your questions in here as big. So I'm looking at a lot of things: substance abuse, suicidality, prior hospitalizations, things of psychosis that are make me a little kind of queasy for my model. And that gives you time that you can reach out to them.
Okay.
And obviously, if you want to do it, so even if, say, on here, you don't want people just to be able to schedule it directly, but you just want them to be able to schedule a time to do the screening, free screening with your person, and then they're able to schedule, you could certainly set it up that way. I certainly understand having it cheaper. I'd say I realized I didn't get to a lot of prices. But I can say, of here, if, when I'm trying to set up other people's clinics to do a similar way, if they do, let's just say you do Charm, EHR, you start basically for free until you get more than 50 encounters a month. Even if you do $20 for fax, I know you can get cheaper fax, but if you want to be built in, that's $20 a month. E-prescribing, let's say it's $250 to $250 a year. Let's see what else is in there. Zoom would be $20 a month if you want to do it through something like Charm. Obviously, I'm here. I'm not a spokesperson for Charm whatsoever. I've just played with a lot. But if there you're looking at, and then e-prescribing, all those things in there, you're doing it for relatively inexpensive. If you look at the grand scheme of it, it's certainly less than $100 a month. I use a Regis office space, which you can find all over the country. What I liked about it was I could not have to sign a huge long-term lease. I can move anywhere across the country at any point. I did. I started with the smallest office I could possibly find, fit my things. And as patients have grown, I've been able to upgrade my office, and now as big as I need it with a window and everything. And I only have to see people in person for their first appointments. And that's where I have all the toys and show people, but it allows you to keep costs a lot down. It has built-in, you have front desk staff to get some coffee, tea, whatever. You have printer, scanner, copier. You have utilities included, internet, furniture, everything else that you would not have in other places. Oh, and then here for vitals, when I see them in person, I do kind of vitals all there on site. If I need to do I'll send people for an EKG or even do a 1-lead EKG with what's it called, cardio, which is just a 1-lead, basically ruling out AFib. But then I have people monitor vitals at the pharmacy when they fill their prescriptions, and then message me the things right back from there. Although right now I have a lot of people that I'll have pick up home blood pressure cuffs and just shoot me pictures of it. And then how do you handle patients who might be drug seeking via telemed? It's a good question. I wonder, how do we work with people who are drug seeking when we see them in person? In the end, I'm going to try and kind of work with the patient. I know I'm probably much more of a people pleaser. If I get burned, I take it very personally and very, very seriously with it. But the biggest things that we do in here is make sure, one, seeing what are the dosing, how are we prescribing it, when are they getting their refills, obviously checking the prescription drug monitoring databases. And for me, it's all about staying on top. If you want to get collateral information, what I found is really helpful when you're working with patients, and a lot of them like that if they have their spouse or their parents, is even if they're both working or in different locations, is I have the patient just give them the same Zoom link, and I'll have the patient, or if they're with their therapist, when they're in the therapist's office, we can all get together on here, just as we all are right now. So actually from my collateral side, I really like that. So if I've had questions, I'll tell them I won't refill until we have a meeting with someone else, be it their spouse or their parent, to go through it. But I just think due diligence as we're working kind of on things. And in the end I think that's personally, I find that we label people as drug seeking when in the end is, are we fully treating them, or is there something else kind of going on? I know it's an issue, and I know there are definitely dangers on both sides, both of treating and not treating kind of people. So I could rant on there, but that's not what I am here for. And I've had some times, and to me, the biggest thing is following the prescriptions. And I'm just trying to think of, I see exactly when things are. I don't do early refills. And if it's any concern, you can have them see as often as you want, and you're not overcharging them for that because it's all included. Let's see.
So did your malpractice insurance cost change after you added telemedicine? Did it affect anything?
What was that?
I'm sorry, did your malpractice insurance costs change after you added telemedicine? Did it affect your rate?
No, it didn't. And the only reason I even went with this model, I thought when I started looking at it, people would tell me I was crazy. And I've been connected with, I never thought I'd be excited. I never thought I'd use a malpractice company, let alone because I've always been with the university and being included. I never thought I'd do anything with them. But PRMS had been very involved in residency education, and a lot of things had done at the APA. So I've just known the people well. I felt bad. I felt like I was just kind of like, they were helping me, and never thought I'd actually be a customer. But being able to have their kind of experts, the risk management lawyers and whatnot, just be able to reach out to them and run what I thought were my crazy ideas kind of by. They were really helpful in talking through getting it there, and it didn't touch the premium at all. And in psychiatry, we have the lowest premiums, I think, of any profession. So that was not a big deal.
Right. Okay. Thank you.
If anybody wants, happy to connect you guys to PRMS. Once again, I'm not a paid person by them, and I never thought I'd be excited for a malpractice company, but how out of their way they have gone, both for residency education, and being there to answer questions is like, I don't see that customer service anywhere else, and I want to give credit where credit's due. Oh, and something if people want, I realize I didn't get this up there. Let me do a screen share here again. This was just a link I added to a website. If you want a link of all those, just the things we talked about, it's just envisionadhd.com/WPA. I'm in it for Wisconsin Psychiatric Association before, but it just has a lot of the websites of the things that we're talking about up here. Let's see once this loads. It's hidden. You won't find the link from the website, but if you just envisionadhd.com/WPA, it'll have everything from. And these, basically, when I was looking, these were all the things that were in the top of what I was looking at when I was choosing things. And I'm just trying to I'm not paid by any of these companies either. I'm just looking through to make sure. Yes, no, I am not paid by any of these companies. But I'd say if I could do it all now, and when I try and set up other people's practices, the more you can do it all within one system, just the easier it is. And if that's something anyone would like to do, is even just sharing templates. If you're in here and you want to find any of the things that I'm using, I have them all shared within like the global charm library. So if anyone is in there, you can search for every one that I use just by searching for Envision. And there's my template form. You can find my all my consent forms under the charm library for questionnaires. Like everything's in there. I'm happy to open everything up. I know I'm one of the weird ones. I'm not afraid to talk dollars and cents with things. I know it's a very taboo area. In some ways, I think we need to be open and know what's going on, but all my other forms in here, if people want any of that, this is the one thing I regret when going through all this was the amount of money wasted on the lawyer just to review and basically just give me templated policy forms. He charged me $5,000 and gave me things I had to enter my own name in because they were just templates. And then anything he wants to do, I find out he's $700 an hour. And if anybody wants to question how much you're worth, is when your accountant is $300 an hour and your lawyer is $700 an hour, there's something wrong. But that is just me. But yeah, if you're interested in your own practice, like if anything you do, I could say if you can get in control of your own schedule so that people doesn't matter where they're working, you have all the gigs you want, but if they're fighting over the slots in your own calendar, that's automatically synced with your personal calendar. So you just keep it open. You don't care if it's a business meeting, a patient from this practice, that practice, this online thing, people just schedule in there with you. That's made my life so much easier. I could not imagine doing that. I don't work with anybody. I basically have no staff, which everyone tells you to expand, but I'm a control freak. I just want to be in control of it all and make it as easy as possible.
So are you doing your own bookkeeping as well?
Yes, I have an accountant, but everything is just done through QuickBooks. So I have what's nice in this is everything comes through Stripe. So it all comes in everything is logged in there, goes into one completely separate business checking account. All my other consulting gigs I have set up as 1099 income through my S Corp. So that all comes in separately. So it's all everything I do is completely separate from my personal.
Great. Okay.
And then the bookkeeping is easy. This is where I like the Chase credit cards. I'm sure the other ones do it as well, but with the business ones, whenever you do a purchase, it'll pop up on your phone if you have the app installed to say, hey, this went through. Do you want to take a picture of it, like tag a receipt or whatever? And then you can download an entire transaction with all the pictures of receipts at the end of the year every time. Plus it'll all sync in QuickBooks, so you see all your transactions. And as long as they're not intertwined with your personal, it's very easy. Only thing I found right now is I haven't paid myself much. I would just pay myself the minimum salary. but I didn't realize I'm trying to buy a house right now. And for the mortgage, they need to look at 2 years. And I have, 2.5 years. I haven't filed for 2018 yet. And they're looking back, and I haven't paid myself huge salaries. So all the money is just sitting there as a giant distribution, but they don't count that in your debt to income ratio, even if you're 100% sole owner. So I kind of screwed myself by not taking my distributions yet. But that's another fact. That's another point. That's another sideline. Doing just fine. It just doesn't look like it on paper because it's all in the business. Oh, excuse me. But I'd say if nobody has, if everybody's still in kind of traditional practices, the two biggest things I find here is, one is, I get a notification if a new patient signs up, it'll pop up from Stripe on my phone, and it like makes my day. It makes me excited. Versus when I was at UW and they put a new patient in my schedule, I was like, in a way, kind of pissed off. Like, I'm booked out for 3 months. How are you putting someone else in my schedule? I won't have time to see them again. And it was like chat roulette. You had no idea what you were going to get, if it was someone that was going to be a good fit for you or not. And in here, I can see it's the person finding me is probably someone that at least, and that's where I think being in a very niche area, at least it's probably going to be, 9 out of 10 times it's the type of patient you're generally kind of looking for. They're going to align with it, that they went on, they saw something about you that they wanted, and it's a different sort of pride. And then when I see them again, doing telemedicine both ways, if you do it all just starting tele versus if you meet them in person and then you connect with them online, I didn't realize how different that would be, where you've built that connection so much more in person. I have a very long, exhausting, 2-hour eval. So by the time I connect with them online again, it's like you didn't miss a beat. And if you don't have screen share or whiteboarding, I feel like I'm practicing with a hand tied behind my back. Like, that's not true telemedicine, because we're not replicating what we do in person. And I'd also say is, if you're not sharing data with your patient, like, it's not that you're doing it wrong, but I realize that's just where I come from. I want to share everything with patients, and I think it's so helpful clinically.
What kinds of things are you whiteboarding?
I'm generally drawing out, to me, a lot of, especially with stimulants, I'm drawing out a lot of, and if you guys have ever seen with Windows ink, like, you have a stylus, it's much better than a normal stylus. It allows you to draw. I'm often drawing neurocircuitry for what's going on with the prefrontal cortex. If I'm looking at, say, like, I'm drawing out how Adderall XR and how the beads are versus the immediate release tablet versus Vyvanse with the powder, with a dexedrine with the lysine attached to it, and then how you're getting a 2-hit release versus just the giant release. So I'm drawing out, to me, there's so much timing in ADHD medications. I'm doing that very often. I'd say that's probably the thing I draw most often.
Got it.
I'm just trying to think. I share my screen more than I draw, I would say. Be it to show rating scales. Even if I'm going over like supplements or things, or they're showing me like book recommendations, I don't care what it is. I'm generally, if patient's talking about it, I'm generally looking it up, and I want them to see what's on my screen so they see what I'm doing and we're looking at it together. So that's generally where I am with that. Or even if they're like updating a credit card, I like it so they can see exactly what I'm entering and where I'm putting it, so it doesn't seem so odd. I always feel weird dealing with that, but I'll bring up Stripe and they'll see me typing it in. It actually helps. So if I mishear a number, they actually catch it. And like your patient can share their screen too. So if they're showing things, and I can tell you sitting here, like, of how great it is when people are at home and they bring their kids are on their lap, or their dog jumps up, and first they're nervous because they feel like you're going to be upset, but then when you ask to see the dog and like to bring him in, they get so excited, and it's just a whole different way of rapport that I found. And I didn't expect. I thought, like, people are at home, they're going to be more relaxed, they're just going to jabber on and on, it's going to be less efficient. I find people are at home, this is just a smaller part of their day now. If they drive to see you and they're stuck in that office for 30 minutes, they're just going to find ways to spend the time. What I find is if they get their questions done, and I'm not billing on time, so it doesn't matter, but if they get in, they check in, they get all their questions answered, they have dinner on the stove, their kids playing in the other room. If it's 5 minutes and they get everything they want, they're trying to get off the phone. I find people are actually a lot more efficient on tele because they have other parts of their life going on. And that's something I not envisioned. Well, let's see. And then the whole idea I want just with the patient portal, I also think, I don't care if you do anything with like genetic testing or lab reports or anything. What I like is that they can just have one place where they will have all of their healthcare data, that they can store it and have it. I know everybody has their MyChart type of things, but I find people, I don't know, at least when I was there, everything was so poorly organized that they can never find anything. And in here, I like it because patients can find their ATAMO report, their entire medical record if they need it, their laid out instructions section for like what to do and how to dose medications, and the look back for supplements, diet, exercise. These are all things just built into templates, but if they need that link for do their rating scales, it's right there.
So are you not charging for medical records then?
Oh, no.
You know how some practices do? Okay.
Yeah, I think that is, I think that's terrible practice. It takes me 2 clicks and then I send it over. I would feel terrible if I did. And if it's for my existing patient, I'm like, hey, that's just included in there.
Right. Sorry, I mean for like attorneys and other things.
I don't.
Okay.
Because they would just pass it on to the patient, and the patient would probably just look at me like, hey, why did you charge me for this?
Oh, no, not charging the patient, charging the attorneys.
I'm saying the attorney is going to go ahead and charge that fee to the patient.
Oh, I see what you're saying. Yeah.
The attorney's is not the one eating that cost. Yeah. So that's how I look at it. And for me, it's seriously like 2 or 3 clicks to download their entire chart PDF. Let me see if I can get in here to encounters. And this is all the encounters for this patient. And I click up here and I go export encounters as PDF. They download down here, and I can, if I want to fax them, it's as easy as where's messages. I'll come here, I'll do fax, I'll put in whatever that number is, and I'll drag this up here, and it'll get added. Oops, my Zoom sharing. Oh, I'm sorry. Are you guys seeing the whiteboard or my screen?
Yeah, whiteboard.
Oh, I'm sorry. That's on me. I was not showing you what I was doing, was I? Share. So actually, let me stop that. Show you this one. Okay. So in here, where am I? Yeah, so all it is coming over to encounters. So you see them all, then up here, I just do export encounters as PDF. It'll download it down here. And then to fax it, and either I can just share it to the patient and they can do whatever they want with it. You don't need to release information then. Or if I want to fax it to a company or whatever, it's just come up, fax, and then I just add it on there, and then that'll fax out. So it is easy. I certainly don't feel like I need to pay staff to kind of do those things. What I like there is it allows you to work asynchronously. I kind of like going to a coffee shop and actually have something I can do. I can't do televisits, but if I'm doing refills, responding to messages or stuff like this, it gives me something that I can do. I feel like I'm getting compensated for it as it is. As part of that monthly model, it's all included. But it's nice, easy work I can do from different places. I'm just trying to think. Think of other advice or tidbits. What I find is it's unique is if you think about how to use these same tools, it's not for every patient, but if you think of the places you work, even with a lot more, like with severe mental illness, but how can you use these type of tools to leverage what you're doing asynchronously with teams? That's why I love the idea of like the ACT teams and community support programs where you have these boots on the ground, such robust people that have subsidized phones with video that they can do, and the ability for them to get in touch with you and you be able to make real-time decisions with patients as opposed to them waiting until that one day a week when there's a doctor on site. And to me, that's where it's been fun is I like to think is I experiment on my high-functioning patients who can leave at any point because they have insurance and they're choosing to be here, which to me is the epitome of informed consent. And then once I get things the way it is, then I go to the other places. I don't take a dime of taxpayer dollars. I don't take any grants. This is all basically experimenting on. Everyone thinks I just work with rich patients, but I'd say the average these are not affluent or kind of wealthy, but it's so difficult to actually get care. What I like to think is, quote unquote, experiment on the willing in a way. And then once it's good, then take it to those, to the underserved, as opposed to taking taxpayer dollars to experiment on the underserved. That is me going on another tirade.
All right. Well, thank you. I'm leaving.
Okay. Well, thank you guys for joining me here. I think I'll see if this was recorded. It's going to be a huge file, but I'll see if I can get it posted somehow. Probably like on a Dropbox kind of thing. But yeah, thank you guys for joining. Anything you need, easiest thing to do is if you just think my email is just jake@envisionadhd.com. Easy way to get in touch. Obviously, see me on Facebook. You can message me on there, but email is probably going to be easier. Happy to help in any way. Certainly exciting times. I don't have all the answers by any means. This is set up to be an evolutionary process, as I think it always should be. I always to continue kind of adapting. Thank you guys for joining. I'll get all this. Let me see how I turn this off. I'll stop recording. Thank you guys for joining.